Lupus. Lupus is a complicated disease that affects different people in different ways. For some, lupus can be mild, for others, it can be life-threatening. Right now, there's no cure for lupus. What is lupus? Lupus is a chronic, long-term disease that can cause inflammation and pain in any part of your body. It's an autoimmune disease, which means that your immune system, the body system that usually fights infections, attacks healthy tissue instead. What is inflammation? Inflammation usually happens when your immune system is fighting an infection or an injury. When lupus makes your immune system attack healthy tissue, it can cause inflammation in lots of different body parts. Symptoms can include swelling and pain. Lupus most commonly affects your skin, joints, internal organs, like your kidneys and heart. Because lupus affects many parts of the body, it can cause a lot of different symptoms. What are the types of lupus? When people talk about lupus, they're usually talking about systemic lupus. But there are 4 kinds of lupus. Systemic lupus erythematosus, SLE, the most common form of lupus. Cutaneous lupus, a form of lupus that is limited to the skin. Drug-induced lupus, a lupus-like disease caused by certain prescription drugs. Neonatal lupus, a rare condition that affects infants of women who have lupus. Who is at risk for developing lupus? Anyone can develop lupus. But certain people are at higher risk for lupus, including women ages 15 to 44. Certain racial or ethnic groups, including people who are African American, Asian American, Hispanic or Latino, Native American, or Pacific Islander. People who have a family member with lupus or another autoimmune disease. What causes lupus? No one knows what causes lupus, but lupus and other autoimmune diseases do run in families. Experts also think it may develop in response to certain hormones, like estrogen, or environmental triggers. An environmental trigger is something outside the body that can bring on symptoms of lupus, or make them worse. What are the early symptoms of lupus? There is no one first sign or symptom of lupus. The early signs and symptoms of lupus are generally the same as the symptoms of lupus, including extreme fatigue, joint pain, or a butterfly rash. However, the early signs vary widely from person to person. Symptoms of lupus. The symptoms of lupus vary from one person to another. Some people have just a few symptoms, while others have many. Lupus can affect any part of your body. Common symptoms include achy joints, arthralgia, fever higher than 100 F, swollen joints, arthritis, constant or severe fatigue, skin rash, ankle swelling. Pain in your chest when breathing deeply, pleurisy. A butterfly-shaped rash across your cheeks and nose, malar rash. Hair loss, sensitivity to the sun or other lights, seizures, mouth or nose sores. Pale or purple fingers or toes when you're cold or stressed, Raynaud's phenomenon. Lupus complications. Many people who have active lupus feel ill in general. They have fever, weight loss, and fatigue. When their immune system attacks a certain organ or part of the body, they can also have more specific problems. Lupus can affect these body parts. 1. Skin. Skin problems are common with lupus. Sore hair loss and mouth sores. If you have a type called discoid lupus, you get large, red, circular rashes that may scar. Sunlight usually irritates skin rashes. A common lupus rash called sub-acute cutaneous lupus erythematosus is often worse after you go out in the sun. You might have it on your arms, legs, and torso. A rare but serious form of lupus rash called a bullous lupus rash causes large blisters. 2. Joints. Arthritis is very common in people who have lupus. It can cause pain, with or without swelling. Stiffness and pain may be worse in the morning. Arthritis may be a problem for only a few days or weeks, or it may be permanent. It's usually not severe. 3. Kidneys. Up to half of people who have lupus get kidney problems. They can be dangerous. These problems are more likely when you also have other lupus symptoms, such as fatigue, arthritis, rash, fever, and weight loss. But they can also happen when you don't have any other symptoms. 4. Blood. People with lupus may have dangerously low numbers of red blood cells, white blood cells, or platelets, particles that help your blood clot. Changes in blood counts may cause fatigue, with a low red cell count, also known as anemia. Serious infections, with a low white cell count, or easy bruising or bleeding, with a low platelet count. Low blood counts. But many people don't have symptoms from low blood counts. It's important to have regular blood tests to spot these problems. Blood clots are more common in people with lupus. They often happen in your legs, called deep venous thrombosis or DVT. In your lungs it is called pulmonary embolism or PE, and sometimes in your brain, stroke. These clots may be tied to how your body makes things called antiphospholipid, APL, antibodies. These are unusual proteins that may make your blood more likely to clot. 5. Brain and spinal cord. Rarely, lupus can cause problems in your brain. You might have confusion, depression, or seizures. When it affects your spinal cord, transverse myelitis, lupus can cause numbness and weakness. 6. Heart and lungs. Heart and lung problems are often caused by inflammation of the tissue covering your heart, pericardium, and lungs, pleura. When these become inflamed, you may have chest pain, an uneven heartbeat, and fluid buildup around your lungs, pleuritis or pleurisy, and heart, pericarditis. Your heart valves in the lung itself can also be affected, leading to shortness of breath. Causes of lupus. Lupus is an autoimmune condition, but the exact cause is unclear. What goes wrong? The immune system is a complex network made up of organs, tissues, and cells. It protects the body by fighting off foreign bodies such as viruses, bacteria, fungi, and toxins. It also clears away dead or faulty cells. The immune system protects the body by producing Y-shaped proteins called antibodies. These antibodies either neutralize a threat or send a signal to other cells to remove it. Specialized white blood cells, called B lymphocytes, produce these antibodies. When a person has an autoimmune condition, such as lupus, the immune system cannot differentiate between unwanted substances, or antigens, and healthy tissue. The body mistakes itself as foreign in error. As a result, the immune system directs antibodies against both the healthy tissue and the antigens. This causes swelling, pain, and tissue damage. Anti-nuclear antibodies, ANAs, are commonly present in people with autoimmune conditions such as lupus. They work by targeting the nucleus of the body's own cells. The nucleus is the part of the cell that contains genetic material. Why does the immune system go wrong? Researchers do not yet entirely understand what causes lupus, but they believe it is caused by multiple factors. One possible theory relates to cell death, a natural process that occurs as the body renews its cells. Research suggests that due to genetic factors, the bodies of people with lupus may not properly clear cells that have died. The dead cells that remain may lead to the production of autoantibodies, such as ANAs, that go on to attack the body, causing lupus symptoms. Risk factors, hormones, genes, and environment. Lupus may develop in response to several factors. These may be hormonal, genetic, environmental, or a combination of these factors. Hormones. Hormones are chemical substances that the body produces. They control and regulate the activity of certain cells and organs. Hormonal activity may offer an explanation for risk factors such as sex and age. The Centers for Disease Control and Prevention, CDC, state that females between the ages of 15 and 44 years are 9 times more likely to have lupus than males. Symptoms and diagnosis often occur between the ages of 15 and 45 years, during reproductive ages. However, 20% of cases appear after the age of 50 years. Some research suggests that exposure to estrogen, a sex hormone that females tend to produce more of than males, can increase the risk of autoimmune conditions such as lupus. This is further supported by many females experiencing more lupus symptoms before menstruation and during pregnancy, when estrogen levels are higher. Although further research is required, the presence of certain sex hormones could explain why lupus is so prevalent in adult females. Genetic factors. Although further research is needed, scientists have identified certain genes that play a role in the immune system response that may contribute to the development of lupus. Evidence suggests that there is a higher chance of a person developing lupus if a family member has it, further supporting the possibility that genetics may be a risk factor. Twin studies also show that if a member of identical twins has lupus, the other has a 24% chance of also developing the disease. Lupus can happen in people with no family history of the disease, but there may be other autoimmune conditions in the family. People of any background can develop lupus, but it is 2 to 3 times more common among the following people: African American, Hispanic or Latina, Asian American, Native American, Alaska Native, Native Hawaiian, and other Pacific Islander females compared with white females. Research suggests that for women of color, symptoms tend to onset earlier and be more severe. This research stresses the need for increased medical support, early diagnosis, and treatment. Lupus risk factors include a combination of genetic and environmental factors. Lupus being more common in certain demographics may partially be due to genetics. However, differences in certain outcomes, such as disease progression and mortality, may be due to social factors such as inequalities in healthcare. Environment. Environmental agents, such as chemicals or viruses, may contribute to triggering lupus in people who are already genetically susceptible. Possible environmental triggers include smoking. Exposure to toxic components of cigarette smoke may lead to genetic mutations and gene activations linked to SLE. Exposure to sunlight. The radiation that comes from direct sunlight can worsen symptoms of pre-existing SLE. However, further research is needed to examine whether it can be a risk factor for developing SLE. UV radiation can lead to cell damage and genetic mutations that may be involved in the development of SLE. Infections such as the Epstein-Barr virus, also known as glandular fever, are much more common in people with SLE. This suggests that it may play a role in the development of the condition for those who are susceptible. Pollutants. In a similar way to cigarette smoke, air pollution may be a risk factor for developing SLE. Are children at risk? Lupus can occur in people of any age. According to the American College of Rheumatology, 20% of people with lupus develop the condition before the age of 20. It is rare for people to develop lupus before the age of 5. Lupus that develops during childhood tends to have more severe symptoms and frequently affects the kidneys, with up to 50% of children having kidney symptoms. Lupus types. Healthcare professionals usually categorize 4 lupus types. Systemic lupus erythematosus. Systemic lupus erythematosus, SLE, is the most common type of lupus. When you hear someone say that they have lupus, it's likely they're referring to SLE. SLE gets its name from the fact that it typically affects several different organ systems of your body. Research shows that these include the kidneys, skin, joints, heart, nervous system, lungs. SLE can range from mild to severe. The condition causes symptoms that may get worse over time and then improve. According to the Lupus Foundation of America, the times when your symptoms get worse are called flares. The periods when they improve or go away are known as remissions. Cutaneous lupus. This type of lupus is generally limited to your skin. It may cause rashes and permanent lesions with scarring. A 2019 review identified several different types of cutaneous lupus, including acute cutaneous lupus. This type causes a characteristic butterfly rash to occur. This is a red rash that appears on the cheeks and nose. Sub-acute cutaneous lupus. This kind of cutaneous lupus causes a rash that's red, raised, and scaly to form on the body. It's often on areas that have been exposed to sunlight and typically doesn't lead to scarring. Chronic cutaneous lupus. This type causes a purple or red rash. It can also cause skin discoloration, scarring, and hair loss. You may also see it called discoid lupus. While acute cutaneous lupus is often associated with lupus in other parts of the body, subacute and chronic cutaneous lupus typically only occur on the skin. Neonatal lupus. This condition is extremely rare and affects infants whose birthing parents have certain autoimmune antibodies. These autoimmune antibodies are transmitted from parent to fetus across the placenta. Not all parents who have these antibodies have symptoms of lupus. In fact, research shows that about 25% of mothers who give birth to a child with neonatal lupus don't have lupus symptoms. However, it's estimated that 50% of these mothers will show symptoms within 3 years. Symptoms of this condition may include a skin rash, low blood cell count, liver problems after birth. While some babies may have developmental issues in the heart, most have symptoms that will go away after several months. If you have these antibodies, you'll need to be followed very closely during pregnancy. Your care team will often include specialists, such as a rheumatologist and high-risk obstetrician. An obstetrician is a doctor who specializes in fetal maternal medicine. Drug-induced lupus. The use of certain prescription medications can lead to drug-induced lupus, DIL. DIL may also be referred to as drug-induced lupus erythematosus, DILE. Research shows that DIL can develop through the long-term use of certain prescribed medications. It typically occurs after just months of taking a drug. Many drugs can cause you to develop DIL. Some examples include antimicrobials, such as terbinafine, an antifungal, and pyrazinamide, a tuberculosis medication. Anticonvulsant drugs, like phenytoin and valproate. Arrhythmia drugs, such as quinidine and procainamide. Drugs for high blood pressure, like hydralazine. Biologics called anti-TNF-alpha agents, such as infliximab and etanercept. While DIL mimics the symptoms of SLE, in most cases the condition doesn't usually affect major organs. However, it can cause pericarditis and pleurisy. DIL. DIL usually goes away within weeks of stopping the medication that caused it to occur. Diagnosis of lupus. Diagnosing lupus is difficult because signs and symptoms vary considerably from person to person. Signs and symptoms of lupus may change over time and overlap with those of many other disorders. No one test can diagnose lupus. The combination of blood and urine tests, signs and symptoms, and physical examination findings leads to the diagnosis. Laboratory tests. Blood and urine tests may include complete blood count. This test measures the number of red blood cells, white blood cells and platelets, as well as the amount of hemoglobin, a protein in red blood cells. Results may indicate you have anemia, which commonly occurs in lupus. A low white blood cell or platelet count may occur in lupus as well. Erythrocyte sedimentation rate. This blood test determines the rate at which red blood cells settle to the bottom of a tube in an hour. A faster than normal rate may indicate a systemic disease, such as lupus. The sedimentation rate isn't specific for any one disease. It may be elevated if you have lupus, an infection, another inflammatory condition, or cancer. Kidney and liver assessment. Blood tests can assess how well your kidneys and liver are functioning. Lupus can affect these organs. Urinalysis. An examination of a sample of your urine may show an increased protein level or red blood cells in the urine. It may occur if lupus has affected your kidneys. Anti-nuclear antibody, ANA, test. A positive test for the presence of these antibodies, produced by your immune system, indicates a stimulated immune system. While most people with lupus have a positive ANA test, most people with a positive ANA do not have lupus. If you test positive for ANA, your doctor may advise more specific antibody testing. Imaging tests. If your doctor suspects that lupus is affecting your lungs or heart, he or she may suggest chest X-ray. An image of your chest may reveal abnormal shadows that suggest fluid or inflammation in your lungs. Echocardiogram. This test uses sound waves to produce real-time images of your beating heart. It can check for problems with your valves and other portions of your heart. Biopsy test for lupus. Lupus can harm your kidneys in many different ways, and treatments can vary, depending on the type of damage that occurs. In some cases, it's necessary to test a small sample of kidney tissue to determine what the best treatment might be. The sample can be obtained with a needle or through a small incision. Skin biopsy is sometimes performed to confirm a diagnosis of lupus affecting the skin. Treatment for lupus. Treatment for lupus depends on your signs and symptoms. Determining whether you should be treated and what medications to use requires a careful discussion of the benefits and risks with your doctor. As your signs and symptoms flare and subside, you and your doctor may find that you'll need to change medications or dosages. The medications most commonly used to control lupus include nonsteroidal anti-inflammatory drugs, NSAIDs. Over-the-counter NSAIDs, such as naproxen sodium and ibuprofen, may be used to treat pain, swelling and fever associated with lupus. Stronger NSAIDs are available by prescription. Side effects of NSAIDs may include stomach bleeding, kidney problems and an increased risk of heart problems. Anti-malarial drugs. Medications commonly used to treat malaria, such as hydroxychloroquine, affect the immune system and can help decrease the risk of lupus flares. Side effects can include stomach upset and, very rarely, damage to the retina of the eye. Regular eye exams are recommended when taking these medications. Corticosteroids, prednisone and other types of corticosteroids can counter the inflammation of lupus. High doses of steroids such as methylprednisolone are often used to control serious disease that involves the kidneys and brain. Side effects include weight gain, easy bruising, thinning bones, high blood pressure, diabetes and increased risk of infection. The risk of side effects increases with higher doses and longer-term therapy. Immunosuppressants, drugs that suppress the immune system may be helpful in serious cases of lupus. Examples include azathioprine, mycophenolate, methotrexate, cyclosporin and leflunomide. Potential side effects may include an increased risk of infection, liver damage, decreased fertility and an increased risk of cancer. Biologics, a different type of medication, belimumab administered intravenously, also reduces lupus symptoms in some people. Side effects include nausea, diarrhea and infections. Rarely, worsening of depression can occur. Rituximab may be beneficial for some people in whom other medications haven't helped. Side effects include allergic reaction to the intravenous infusion and infections. In clinical trials, voclosporin has been shown to be effective in treating lupus. Other potential drugs to treat lupus are currently being studied, including abatacept, anifrolumab and others. Can lupus be cured? There's currently no cure for lupus. Treatment of lupus is focused on controlling your symptoms and limiting the amount of the damage the disease does to your body. The condition can be managed to minimize the impact lupus has on your life, but it will never go away. Can you die from lupus? In most cases, death wouldn't be caused directly by lupus, but by the symptoms and damage to organs. Issues like kidney damage, cardiovascular disease and infections can cause serious harm and be life-threatening. Is lupus contagious? Lupus is not contagious and cannot be passed from one person to another by touch, sneeze or cough. Can I get pregnant if I have lupus? Women with lupus can get pregnant. However, there is a risk of poor pregnancy outcomes, miscarriage, in people with lupus. If you're considering a future pregnancy, start talking to your doctor several months in advance during a pre-conception appointment. Your doctor may need to adjust your lupus medications to ensure that they're safe for pregnancy. If I have lupus, will I pass it on to my children? There can be a genetic factor to lupus. Your risk of having lupus increases if you have other family members with the condition. A mother with lupus can pass it on to her child. However, this doesn't always happen, nor does it happen often. Some women with lupus deliver a baby with the condition, while others do not. If you have a family history of lupus or of lupus yourself and are thinking about getting pregnant, talk to your doctor. What can I do to prevent lupus flare-ups? While lupus itself can't be prevented, you can make changes to your daily life to help avoid flare-ups of your symptoms. A few things to try can include avoiding sun exposure. For many with lupus, sun exposure can be an issue. Try avoiding going outside during peak hours when the sun is out, wearing protective clothing, long sleeves and a brimmed hat, and wearing sunscreen. Staying in motion. Joint pain can make you want to sit down and rest, but doing low-impact exercises can actually help. Maintaining healthy habits. A few habits to keep in mind include making healthy choices when it comes to your food, getting plenty of sleep and cutting back on the stress in your life. There is also a strong link between lupus and heart disease. Make sure you are working with your doctor to reduce your risk of heart issues.